Resuming debate, the honourable member for Calgary Confederation.
Mr. Speaker, it is my pleasure to rise today to speak to Motion 189 that seeks to improve the organ and tissue donation system here in Canada. It is a very timely issue for the debate in the House, Mr. Speaker, as this week we saw, first of all, the tabling of the Health Committee's report on organ donation, and then the same week, the second reading of my private member's bill on organ donation, and now this motion 189 on organ donation. So it truly was an organ donation week here in the House, Mr. Speaker. Like the honourable member from Thérèse de Blainville, I've been a long-time advocate of organ and tissue donation in Canada, and I've heard many triumphant and also tragic stories related to organ and tissue donation. As a former MLA, I passed a bill in the Alberta Legislature resulting in the creation of the Alberta Organ and Tissue Donation Registry. But more work needs to be done to get Canadians on board, and so, as I mentioned, I introduced another bill just this week here in the House of Commons. That bill proposes that we amend the annual income tax return to ask Canadians if they wish to become organ and tissue donors. It has the potential to register millions more donors. We know, Mr. Speaker, that over 90% of Canadians support organ and tissue donation, but just over 20% of Canadians are registered. We need to do better, and we can do better. And I'm honoured to have the member from Thérèse de Blainville as an official seconder of my bill, and I certainly will be supporting his initiatives here with Motion 189. Also on Tuesday this week, as I mentioned, the House of Commons Standing Committee on Health presented an important report regarding organ and tissue donation. The report is an accumulation of the work that we did together after I proposed a study at the committee. I must note that the committee did an amazing job of working together towards a common goal, and I must thank the honourable committee members for allowing this study to happen. This nonpartisan effort, along with the tremendous expertise testimony that we received, made the report a fair and accurate representation of the study we undertook. I'd like to take a moment to highlight some of the key items from the report as they speak directly in support of Motion 189. We found that the federal government can help by, number one, supporting the adoption of best practices in organ donation and transplantation across all jurisdictions. Number two, investing in national public education and awareness campaigns to promote the conversation among family members regarding organ donation. Number three, creating more opportunities for Canadians to register their decisions regarding organ donation. And number four, providing sustained funding for research and data collection to ensure that organ transplantation results in improved health outcomes for Canadians. The Health Committee, Mr. Speaker, quickly agreed on a number of key recommendations after listening to these key stakeholders and experts. And so our recommendations in the Health Committee, Mr. Speaker, include, one, that the Government of Canada provide the Canadian Blood Services with sustained funding to A, strengthen and expand upon existing interprovincial organ donation and transplantation sharing programs. B, develop a sustained national multimedia public awareness campaign to promote organ donation. And C, promote the adoption of best practices in organ donation and transplantation across the country. Second recommendation, that the Health Minister establish a working group with provincial and territorial ministers of health to examine best practices in organ donation legislation across the country, such as the adaptation of mandatory referral of any potential organ donor, and identify any barriers to the implementation of these best practices. Our third recommendation, that the Government of Canada identify and create opportunities for Canadians to register as organ donors through access points for federal programs and services in collaboration with provincial and territorial organ donation programs. Of course, Mr. Speaker, I have to note that this particular recommendation directly supports my bill C-316 and my efforts to amend the annual tax return so that Canadians can register as donors. The fourth recommendation of our Health Committee, that the Government of Canada provide information and education to Canadians regarding organ donation as part of its efforts to promote organ donation registration through federal programs and service access points. The fifth recommendation, that the Government of Canada continue to provide funding for organ donation and transplantation research through its networks of Centres of Excellence program. And finally, the sixth recommendation of our report, that the Canadian Institute for Health Information and the Canadian Blood Services work together to develop a national data collection system to monitor outcomes in organ donation, to support research and systems improvement. Mr. Speaker, improving the transplant system in Canada is not a political issue. It is a human issue. I believe we have a united House when it comes to dealing with this issue of organ donation, and I firmly believe that we can improve the system. We have a potential to save hundreds of lives and improve the quality of lives for many Canadians in every community of this great country. Inaction or delays on making necessary improvements will cost lives and will cost money. It is a known fact, Mr. Speaker, that life-saving transplants are a cost savings to our medical system because it removes the dependence of thousands from costly treatments and hospitalizations. This leaves more resources for other challenges to be addressed. I recognize that in Canada, because organ and tissue donor registries are a provincial jurisdiction, we face some unique challenges in implementing change. That said, I also believe that where there is a will, there is a way. I believe Canada can move from a country with one of the worst organ donation rates in the world to one of the best. I believe Canadians will register in greater numbers if we make the process easier and more convenient. I believe we need to be innovative in how we reach potential donors and how we educate and inform potential donors. And I also believe we need to do a great deal more to work to make sure that families respect the wishes of their family members. The amount of people who want to donate but have that decision overruled by their surviving families is shocking. One study suggests that 1 in 5 donors do not have their relatives respect their wish to donate. We need to open up the discussion in Canada so that we do not bury perfectly good organs every day, while others in our community face death daily waiting for a life-saving transplant. In closing, Mr. Speaker, I would like to thank again my colleagues from all parties for their support on this issue that is so close to my heart. I want to thank them for their nonpartisan and collaborative support to improve the lives of so many Canadians. I believe that we can achieve some great things here if we all continue to pull in the same direction, and for this reason, I am proud to be a strong supporter of Motion 189. Thank you, Mr. Speaker.
Resuming debate.